Buying or selling?
Now arrived at our closing quarter of Women's Worldview for this week, and this quarter is called The World of Dentistry. The moderator here is Dr. Rajesh Nandan Mehra, the founder and the director of Chantilly Family Practice Center located in Chantilly, Virginia. This week, Dr. Mehra has a whole bunch of questions for Dr. Dipti Mahajan of Rockville Smiles Design. The topic in discussion, restorative dentistry.
Good morning. This is Dr. Rajesh Mehra bringing you the world of dentistry. I'm honored and privileged to have with me in our studios again Dr. Dipti Mahajan from Rockville Smile Design. She's a prominent dentist in the Metro DC area, and we started a series on dental health, dental topics, and other things that you would like to email us about, that you have questions that you were either afraid to ask or just never have the time, because as doctors, when you go to a dental appointment, the dentist may be busy. So please send us your emails with any specific questions, and we'll be happy to answer them in our next show. Dr. Mahajan, welcome.
Thank you for having me.
Yes, good. I hope you had a busy month, because we started this series a couple of weeks ago, and since then, I'm sure things have been busy.
That's right, and it's the year is coming to an end, and so people are keen to get all their work done before the year ends. So
that's right. Insurance deductibles, money's going towards buying gifts for family and Christmas, but we can't ignore our health and our teeth, right?
That is very true. That is very true. And they say your health is your greatest wealth.
That's right.
So you have to take care of your health and your teeth.
That's right. Part of health is your teeth.
That is
oral
true.
care, right? As I always say, health is wealth, and if you have no health, there is no wealth.
There is no wealth.
There's no wealth. That's the favorite topic here. So we discussed in our last week the importance of getting an exam done every 6 months, letting the dentist check everything. Today we want to discuss a topic which I know that you enjoy and you like doing this, is restorative dentistry. Tell us first of all, what exactly does that even mean?
Sure, I would love to. You know, our teeth are compromised of different layers. We have the outer layer, which is called as the enamel, and then we have dentin and we have pulp, which houses the blood vessels and the nerve for the teeth. So anytime there is a disruption on the enamel, it's called a cavity. When there is a bacterial, when you eat food and the bacteria produces acid, you end up losing enamel. It creates a cavity. So we restore that. That's part of restorative dentistry. And then also your teeth are suspended in your sockets with ligaments, and the bone is covered by the gum. So those are your supporting tissues. So anything pertaining to gums, inflammation, bone loss due to periodontal disease, all of these are included in restorative dentistry.
I see. So taking care of the gums and all of that is part of, now, so that brings me back to my kind of a hard question is, what is the difference between a periodontist and an orthodontist and a general dentist?
Okay, that's a very good question. I think the viewers would like to know the difference. A general dentist is like your family practice. You know, you go to your primary care physician who takes care of your family, your children, and does an overall assessment of your dental health. And then based on their evaluation, if they see that you have bone loss or the gums are inflamed or if you have pockets, they refer you to a periodontist.
Gotcha.
A periodontist is a specialist who specializes in the supportive tissues of the teeth, namely the gums and the bone and the ligaments. So that's a periodontist. An orthodontist is a dentist who aligns teeth into a nice curvature. You know, we all like to have nice straight teeth,
Perfect
and
teeth,
pretty teeth and good smiles. And the orthodontist actually moves those teeth around so they are in perfect alignment. And the orthodontist's work also affects the periodontist.
Of course.
Because whenever you move teeth around,
the soft tissue is going to be affected.
There you go, there you go. The soft tissue follows the hard tissue. So anytime you move the teeth, the bone will move along with it, the gums will move along with it. So an orthodontist straightens the teeth out.
Right.
A periodontist takes care of your supporting tissues, namely the bone, the gum, and the ligaments.
Perfect. Now, since you like doing this restorative stuff, tell us a little bit about materials that are used. You know, there's all kinds of technological advances in cements and all of these things that I don't even know much about.
Right, right. Well, let me go back as to when the dentistry was being practiced centuries ago and decades ago. We used to use gold. And that is the best material dentistry has ever seen. But however, the price of gold has gone up.
Slightly higher than it was before.
It was, and it's very cumbersome for the dental lab technician to manipulate the very flowable gold into restoration. So because of the cost, we kind of gave it up. Then comes the silver fillings, the amalgams, and they were very good to restore your teeth with, except that they have mercury. So now,
and that's not healthy.
And that's not healthy for you. And there was a big, patients and other people say, oh, do I need to have these silver fillings? Do I need to remove them? The ADA has not said that they cause any harm because of mercury, but if you prefer them removed, let your dentist know and we can always remove it. But there is no scientific basis of it causing more harm to you than eating fish, because you can get mercury through fish consumption as well.
Sure.
So the American Dental Association has, put down that it's not that harmful, but still, if you feel the need for changing them, and they do get bad over a period of time, so we replace them. And now we are into composites and resins and porcelains, and I'm telling you, Dr. Mehra, the dentistry.
It's a whole science, right?
It's,
you could study that all day.
It's a whole different field of materials. And now we have computer-aided design and computer-aided manufacturing, where the impression is taken, it's put in a CAD/CAM machine, and it mills the crown.
Wow.
So, and it's very fast, very technique sensitive, very accurate. So that's where dentistry is going nowadays, with all these new developments and porcelains and resins and cosmetic fillings have come up. And so we do all of that, and it's a very exciting time for dentistry. We are seeing a lot of advancement.
Right. So in summary, there's a lot of choices and a lot of advances that are coming. It's not the same old gold, silver, and that kind of stuff. Now, an important part of this is some people have bone loss when you examine them. So before you tell us what you do with the bone loss, let's talk about what are some common causes for bone loss.
Yes. That again goes back to the same question, prevention is better than cure, and you have to go back to your dentist every 6 months for your checkup and cleaning. If you don't go for a year, and like I said, the plaque forms around your teeth within the 12 hours. The biofilm is there, and if you don't brush for 48 hours, it starts calcifying. Now, if you don't brush for 10 days, that calcified plaque is going to become into calculus, and they are matrices for bacteria. They house bacteria, and they create a lot of bone loss. They create a lot of cavities on teeth. So that plaque and calculus deposits around your teeth causes bone loss. Yes.
Okay. And is that picked up only on X-ray, or can you see it?
We can see it. You can visually see that in the patient's mouth, and also on X-rays it will tell you how much below the gum those deposits are. So we have to take X-rays in those cases as well.
Right. Now, what about in athletics, whether young or old, it doesn't matter. Somebody loses a tooth or damages a tooth. How do you handle that?
It depends on the kind of fracture or trauma. Sometimes the tooth itself comes out. It's called tooth avulsion. And if that happens to any kid, I think the parents should immediately clean the tooth and put it in milk in a Ziploc bag and go to the dentist.
In milk?
In milk, because the calcium.
Calcium,
yeah,
it preserves it.
Preserves the ligaments of the tooth. And it can be reimplanted in the socket. And the dentist can do that.
Wow, and how long a time though between, was that
Very
possible?
critical. That time is very critical. So you have to take the tooth and your child to the dentist within the first hour.
Oh, okay.
Yeah, so you cannot
That's hard.
preserve it and keep it in the fridge and go on Monday.
Next
You
morning,
cannot.
okay.
No.
So it have to be, I mean, unfortunately, kids are playing sports all
Right.
time of the day. It's a
Right.
football game, hockey game, basketball
Right.
game. So it
Right.
would have to be pretty acute. But all right, so most people can't do that though. So what's
Right.
the next step?
So, and also what we do with children is we give them sports guard. When they are playing sports, we give them a guard to wear to prevent any fractures or prevent any tooth avulsions. And then when they do get a fracture, then there are various treatments. Some can be restored with a filling, others may need a root canal and a crown. So it depends on the level of
Kind of
injury.
it's not a cookbook type thing.
No, it depends, you know, how bad it is. The whole tooth can come out, or it could be just a minor chip or a fracture or a complete half the tooth gone. It all depends on the level of injury.
Right. In this restorative world, besides the fact that you alluded to the materials are all changing, are there any other sort of upcoming advances that you want to share with our audience, or innovative things that you're doing or that are on the horizon?
Sure. I think, like I said, it's an exciting time for dentists and in the field of dentistry, in the world of dentistry. And if you happen to lose a tooth because of bone loss, we do dental implants nowadays, which is a titanium fixture put in your bone to restore those teeth. And also, if you have cavities, those things can easily be taken care of nowadays. So always go for your 6-month exam and cleaning and checkup, because that's the time when we pick up on things as to your gums and bones and your cavities. So it's very important to.
Very important.
Yeah.
Excellent. So many good ideas, hints, and suggestions for you to follow good dental health as in any health topic. Frequent checkups and getting to the problem sooner than later. Don't put it off. That's really, I think, the message that we're trying to say here,
That's right.
whether it's medical health or dental health. And I think you'll be ahead of the game. Thank you so much. We look forward to having you again. And we wish all our viewers a very happy Christmas and a new year.
Yes.
And same to you.
Thank
Hope
you.
you have a very prosperous new year.
Thank you very much, Dr. Mehra. Thanks for having me.